Precision Plus Drug Screen Cup Operational Tutorial. The Precision Plus Drug Screen Cup comes in a box of 25 individually sealed devices. The label on the outside of each box contains specific product information of the contents, including a specific listing of drugs deducted and the cutoff level, catalog information number, item number, lot number, quantity, storage temperature, and expiration date. Precision Plus Test Cup detects multiple drug and drug metabolites in human urine. Each box contains a product insert, an adulteration color card chart, and individually foil pouch sealed testing devices. Inside each box there is a product insert for your reference. It is important to review the product insert prior to administering the test, as the product insert contains critical information including the drug tested and cutoff levels, summary and description of each drug, directions for use, interpretation of results. When administering the Precision Plus Test Cup, it is important to ensure the test device is at room temperature 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit prior to testing. Do not open the test device pouch until ready to perform the test. When you are ready to administer the testing device, open the pouch and take out the test cup. The results section is covered and can be revealed by peeling back the red tab from left to right. Depending on your preference, the results window can be exposed before or after the collection. The results window is covered to prevent the donor from seeing the results prior to the collector doing the formal interpretation. 20-panel Precision Plus Test Cup used in this video contains single-line and multi-line test strips. To fit 20 drug strips into one device, there may be a few test strips that contain more than one drug. Precision Plus uses single strips in all our devices that detect up to 17 drugs with 3 ADS or 18 drugs without ADS. Beyond that, paired drugs are used on a single strip. Each test comes with easy-to-read interpretation instructions located at the base of the device. In addition to absorb collections, the temperature strip is one of the most effective indicators of sample integrity. An acceptable urine temperature of a drug test falls between the range of 32 to 38 degrees Celsius or 90 to 100 degrees Fahrenheit. When obtained, the sample should register between 94 to 96 degrees Fahrenheit. For ease of use and convenience, we have placed the donor sticker on top of the cup. Observing the temperature strip should be one of the first actions taken upon sample collection to ensure the sample falls within acceptable temperatures. Synthetic urine and adulteration with water or other substances may not register the temperature within guidelines. Ensuring adequate temperature at the time of collection is a good way to rule out many forms of tampering. If the sample is out of range, have the donor provide another sample. Reading the adulteration pads. Inside each box of Precision Plus test kits is an adulteration chart. This chart should be referenced against the pads on the test cup for color match to determine if it is normal or abnormal. Further adulteration examination can be done by sending the sample to the lab. We are now ready to begin interpreting the results. There is no minimum fill line required to activate the Precision Plus Test Cup, but approximately 30 ml of the urine sample is recommended. Although less than 30 ml of urine will work with the device, it is important to collect enough of the sample to be sent for confirmation if required. Once the sample is collected, tightly secure the lid. It is recommended test results be read 5 minutes after the collection. One of the important steps in reading the results is waiting long enough for the test lines to complete, especially on presumptive positive test results. If a result does not have a line at the 3-minute mark, it would be premature to call that a presumptive positive, as the collector did not wait a full 5 minutes before looking for a hint of a line. Results are considered valid and stable for 60 minutes after collection. Interpreting the results. As you can see, many results begin to appear within seconds. It is recommended results be read after 5 minutes. In some instances, results will be available sooner, especially with a negative sample. Once the control line is present, test can be considered valid and ready to read. Once the control line is present, the test can be considered valid and ready to read. As you can see, C and T lines have already formed on most of the strips. For the multi-line test strips, the test line is labeled T1 and T2. T1 corresponds with the bottom drug, and T2 to the top. In this illustration, the multi-test strip contains T1 cocaine and T2 THC. The T1 cocaine does not have a test line present and is presumptive positive, while the T2 THC does have a test line present and should be considered negative. The single test strip for ETG is considered negative, as there is a line present. If the sample is negative and no other action is required, safely dispose of the sample and sample cup. The sample of a presumptive positive seal according to your policy and procedures for dealing with presumptive positive samples, such as sending it to a lab for further confirmation. If you have any questions relating to any of our drug test device, please contact us.